Dr. Eileen Setti is the Chief Operating Officer of Ronald McDonald House Charities of Central Illinois, which provides temporary housing and support for families who travel so their child can receive medical care. Ronald McDonald House also provides programming for local families who are not traveling a great distance but still need support. Dr. Setti is a certified group facilitator and for more than 25 years has specialized in nonprofit organizational development through strategic planning, action planning, board development, and executive coaching. She has worked with hundreds of groups of nonprofits in Central Illinois and throughout the U.S. The organizations she has influenced includes those in early childhood development, foster care, homelessness, and affordable housing, community foundations, libraries and fine arts, museums, food pantries, human services, local government, schools, and higher education. Dr. Setti is affiliate faculty at Bradley University in the Nonprofit Leadership Graduate Program where she teaches strategic planning. Dr. Setti holds a bachelor's degree in sociology and psychology from Eureka College, a master's degree in sociology and anthropology from Loyola University, Chicago, and doctorate in political science with specialization in public administration and nonprofit management from Northern Illinois University. Her research focuses on innovation and capacity building in the nonprofit sector. Dr. Setti serves on the St. Francis Medical Center College of Nursing Board, the WCVU Community Advisory Board, the Birth to 5 Illinois Region of 48 Action Council, and the First English Lutheran Church Council. Dr. Setti is married to Chris Setti of the Greater Peoria Economic Development Council. They're desperately trying to launch their young adult daughters into the world. They live in the historic Uplands neighborhood in Peoria, Illinois, in a beautiful home that's always under renovation and or repair, with their boxer Onyx, who is lazy and poorly behaved. Dr. Setti?
I don't know if it's the husband or if it's the boxer that's more poorly behaved, but I understand that my husband Chris was here a couple of weeks ago to present. Did anybody fall asleep? Every time I would fall asleep with him speaking. So, well, first of all, greetings from downtown Peoria Rotary. I'm a member there, and I want to take this opportunity, because John didn't, that we are still looking for a third family to host our exchange student, Zhao from Brazil. We have a young family from the Peoria Rotary Group that's going to house him from July to about October. We take him in November. I'm so not ready for this because we actually did launch our two daughters. And so when I talked to Chris about hosting the student, he looked at me and he's like, "We just got rid of kids. Why would we want another one?" And so when he found out that it was a boy, he's like, "A boy could live in our house with us?" So then, he was really excited. So we'll have him from November to February, and then we're looking for a family from February to May. So if you're interested, please let us know. I think it's a really fun opportunity to host that student. So I'm here today not to talk about Ronald McDonald House, but I love preaching the gospel of Ronald McDonald House. So if you have questions, I'm happy to chat after. I'm here today representing the Human Services Collaborative. And I know there are several nonprofits represented in your club and are here today. And many of those groups are active in the Human Services Collaborative. And we did a study on the economic impact of the human services sector in Central Illinois. And so that's what I'm going to talk to you about today. So first, a little bit about the Human Services Collaborative. This group came together about 15 years ago, and with really, really smart people like Martha Hearn and Kim Cronwell, and who were really interested in learning more about the impact that the nonprofit sector was having in our community. Let's face it, nonprofits like us are constantly asking for funding, and Peoria truly is a very generous community. Central Illinois in particular is very generous. But we always have a lot of people who who believe that the nonprofit sector is a drain on the economy. And this wasn't even just 15 years ago, 20 years ago. I had a conversation a couple of weeks ago with a large local funder who flat out said, you are just begging, you are sucking the economy, like you are not helping us at all. I lost my mind, got out my study, and started giving some very clear facts about how the human services sector really does impact our economy. So that mindset is still, unfortunately, alive and well today. And so when these human services organizations came together, they really didn't know what they were going to find. And so the Human Services Collaborative, it's organizations from Peoria, Tazewell, and Woodford County, so kind of our three counties that we often collaborate together. We commission the Illinois Partners for Human Services in Western Illinois to do this research. So this research is being done by somebody at Western who does academic research. So this is a high quality study. And the first study was in 2012. We replicate it about every 3 years. And actually it's getting to be time to start planning the next study. So the most recent study was done in 2024. So there are 97 human services organizations in the Tri-County area. And so out of those nearly 100, we just rounded up to 100 because the math is easier to do. We had 30 organizations who responded to the 2024 study, so a 31% response rate. And so that's about 30% of the total of human services organizations in the Tri-County area. And that's really important because it's only 30% of the organizations who reported. So that means that these numbers that I'm about to report on are actually very low because it's only 30% of those organizations. And note, human service organizations are nonprofits, but it excludes organizations whose missions are devoted to art, advocacy, social clubs, healthcare. So OSF and CARL are not part of this report, or other types of organizations. So this is just human services organizations. So I want to highlight a couple of the findings. So first of all, I don't think people realize what an employer the human services sector really is. So we are the 5th largest employer in the Tri-County area. And again, that's only with 30% of our organizations reporting. So we're actually probably larger than Peoria Public Schools if we had 100% response rate. So we are a pretty large sector. I am constantly talking to students at Bradley. I do mentoring, and I just work with a lot of kids, and nobody usually plans to have a career in the nonprofit sector, right? Any of you nonprofit leaders ever I never at 10 said, I'm going to grow up and be a chief operating officer at a nonprofit. Like, that sounds terrible. But it's such a wonderful sector. And I think what we're seeing with Gen Z wants to save the world, right? Like, they are so very committed to service and change. And my hunch is that we are going to get more of those Gen Zers involved in the sector, and which is great because as baby boomers are retiring, and the human services sector is very skewed towards baby boomers, so it'll be nice if Gen Z can come in. So we are a top 5 employer in Central Illinois. We are an economic engine. So this is your return on investment. So when you give $1 to a human services organization in Central Illinois, the economic impact is $1.61, which is a pretty darn good return on your investment. So I don't know what the economic modeling razzmatazz is that they did at Western Illinois, but they ran this through an economic model of the employee works and lives here. They're using their salary to, for purchasing power, right? Like, what is the economic engine that we are creating with our employees? So For every dollar that you donate to a human services organization, it's generating $1.61 in our economy. Our economic output. So our economic output is over $400 million, almost 401, or 1.4% of Central Illinois' GDP. So again, this is because we are large employers, and because we do so much work, we are really making an impact with that GDP. So I just think of things, I got the dreaded email yesterday, we're out of copy paper. Like, why are we always out of copy paper at Ronald McDonald House, I swear. So where are we gonna go buy copy paper? Well, we're gonna go to Office Depot, and right? So that's part of our purchasing power, that's part of the impact that we're having in our community. And funding sources. I know that there's, we've had a lot of cuts in state and federal funding for social service organizations, and the human services sector has really, really been hit the last couple of years. But we know that 62% of our funding is still coming from public sources, so federal, state, and local government programs. So community development block grants, specific funding, things like Meals on Wheels. 37% is coming from all other sources, so things like foundations, individuals, special events. So nonprofits know that we have to have a diverse funding portfolio, right? Like, we can't solely rely on government sources. We can't solely, rely on grants. We have to have a very diverse funding stream in order to fund our programs and do what we need to do. But when you look at the data, we are still skewed heavily towards public funding. A lot of that is probably through contracts rather than through grants. And so we need to realize that, and there are a lot of nonprofits that are lobbying our state legislators, making sure that they are aware of what we do, how we do it, what sort of impact that we are providing in our communities. So philanthropy cannot replace public investment in the human services sector. It's going to take everybody funding our programs. We definitely are an economic engine. I know sometimes it feels like maybe we're not, but the numbers don't lie. We are definitely an economic engine. And we are a vital contributor to our community. So being part of community decisions and providing input, we are often the voice of many who don't often have a voice in community decisions. And so that's something that we are very happy to do and will continue to do. So if one of the things that we're trying to do, the Human Services Collaborative, one of the things that we're trying to do is to get this information out into our community. On our website, this presentation is posted as a narrated PowerPoint. You have to listen to me again, so sorry about that. It's about an 8-minute video, so it would be a great opportunity at your religious organizations, at your nonprofit boards, at anywhere, just so people can learn a little bit more about the human services sector and the impact that we have. So we definitely encourage you to do that. And then the Human Services Collaborative, we do more than just the economic impact study. We actually meet monthly, and we invite a speaker. It's on Friday mornings at 8 o'clock, just feels really early on a Friday. And we invite different speakers to come in to talk about programs and services that the human services organizations may not know about or that we could connect with in some way. So for example, we've had job training from ICC come, because that's a great opportunity for us to learn about services that are available that we can provide our clients. We've had speakers like from the county health departments to talk about programs that are available. And this meeting is a really good time for us to collaborate. I know there's also a kind of a perception in the community that, oh gosh, we already, we have a ton of organizations that are addressing the homeless situation. Why do we need another? Or don't they do the same thing? or these organizations are working in silos. They don't collaborate, and we definitely collaborate. And a lot of those collaborations begin here at the Human Services Collaborative meetings. So if you would like to be a presenter, if you feel like you have something that could be important to any of our clients or the people that we serve, or it could be something that could help our organizations, we would be happy to have you and come and listen, because we are collaborative is in our name. We definitely want to collaborate. So that's a little bit about the economic impact that we have in Central Illinois. So questions? Oh gosh, Julie's got the microphone. And no questions from Don, Julie.
Yeah, thank you for being with us today. Appreciate that. I was wondering, does your organization attend the Mayor Safety Network meeting held each month? Because there's a lot of people in this space that are there, and the idea of you working in collaborative, settings would be really helpful, I think.
No, I'm not aware of anybody, but the collaborative has about 50 members, and so there could be somebody that's going. But can I meet with you afterwards? I'd love to get some information, because that would be a great opportunity.
You told us what is excluded from human services. Could you give me a better idea of what is included when under the umbrella of human services? What sort of organizations?
So think of childcare, neighborhood house, EPIC, CWTC, so working with individuals with disabilities, childcare organizations. We have some folks, we have Dunlap's social workers come to our meetings as well, because it's a great opportunity for them to get connected with services that are available that they could refer. Yeah, Children's Home, Phoenix Community Development Services, Center for Prevention of Abuse. So if the client is a person, it's a human being, and there's some sort of service that person needs, that would qualify as a human services organization, and then you exclude healthcare. And I would love to replicate this study with all of the nonprofits. I think that would be fascinating to see as a larger sector what our impact is. Yes?
Why are you different than United Way?
Because we are not raising money, and we are not, we're not raising money or doing anything like that. We're just coming together to share ideas. There's no membership fee. You just get on the email list and show up and start working together. So yeah, this is not a funding stream. When we first came together, I think it was a whopping $50 to join. And so we were able then to raise some money, and then that's what we use to fund this study, because we are charged to fund that study. So if we ever do a program or anything that we hire a speaker or something, then we have that bank account. But yeah, we're not raising money. We're just collaborating and trying to do gooder, I guess, is what we're doing.
So I was kind of disappointed to hear that you had such a low response rate on your survey, and I question why you would have less than 100%, seeing as how you're asking, or you're basically trying to take the pulse of not-for-profits in general, and there's a huge, I think there's something going on in the country right now about questioning whether or not not-for-profits are all on the up and up, and you would think that transparency would be, one of those things that the Peoria area would want to engage their human services departments. I don't know, what's your take on it?
Yeah, well, I can tell you why. Ronald McDonald House, I'm the COO of Ronald McDonald House, and we didn't complete the survey, and it was because we have a house in Peoria, and we have a house in Springfield, and our budget is co-mingled. So I have no idea. The survey asks you, how much does it cost you to run your nonprofit organization in Peoria? And I'm like, I don't know, because we haven't pulled that apart in our budget. So we have now started doing that. So when the next survey comes through, we can participate in this survey. I don't think it's a matter necessarily of transparency, because I would disagree with your comment, because when you go to nonprofit organizations, especially here in Central Illinois, their annual reports are right on their website. You can access information, and I don't think I know a nonprofit leader in Peoria who would not take a meeting with somebody who's got questions. But I do know that, Julie's gonna laugh at me, nonprofits are really strapped for time, right? So if my finance director has a little gap of time to pay the bills, which are kind of important, or to complete a survey where you're not gonna get any funding, you're not, right? Like, you know it's a good thing, right? Because it's gonna help the community. I bet you that finance person is going to pay the bills, right? So I think it's a lot of the nonprofit organizations in our community, probably all of them, are understaffed, and many of them do not have dedicated financial folks to complete this type of survey. So I agree with you that it's unfortunate that our response rate wasn't higher. And I know the next survey that we want to do, we really want to work on that, because it's a great story, and we don't know unless that survey is completed. So yeah, it's a double-edged sword. It's important information, but it's difficult to generate.
Again, thank you for being here. I had a good conversation with your husband when he was here, and I thought it was invigorating the message he had for us.
Do you know who I'm married to?
I know, for 25 years, I feel. So tell us more about, if you can, I'm sure you can, Ronald McDonald House, and do you need volunteers?
Yeah.
Where's the money come from? And it's a great building, newer building downtown.
Yeah, thank you. So Ronald McDonald House in Peoria is 6 years old. Our chapter is 40 years this year. The Springfield House was built in 1986. We have 22 rooms in Peoria, and I looked yesterday, and occupancy was 21, somebody coming in today. So yes, there are lots of volunteer opportunities, everything from cooking meals for families, because families are hungry, let me tell you. Cooking meals for family, creating care packages for them, cleaning, like think of your house with 22 bedrooms and it full all the time. Cleaning is always a thing. Our volunteers, we have kids that can come volunteer as long as they have an adult supervising, because I'm not going to supervise the kids. But there's always something to do, and our families, they are on a journey. They are away from home. They are dealing with their child having an illness or some sort of catastrophic event. They are away from their support network. They are away from things like their pillow and their toothbrush, the simple things in life. And so we provide those things. So we're always doing supply drives of shampoo and toothpaste and toothbrushes. That's toothpaste and toothbrushes. Those are our number one things. We also have a hospitality cart that runs at the Children's Hospital of Illinois. Think of a Walgreens on wheels. So everything from decks of cards and Uno. Uno is like one of the top sellers on the hospitality cart. To sleeping masks, so a parent could actually get a nap in their child's hospital room, to snacks and everything in between. So if you would like to come volunteer, you can go to our website. There's a volunteer page. If you'd like to cook a meal, you can sign up for what day you want to cook the meal. And cooking meals is a pretty amazing experience, because you see those families come back from the hospital or their long days of treatment. And they are just so very grateful to have a hot meal.
And the funding?
Second?
And the funding?
Oh, the funding. No government funding. So we run everything. All of our funding comes from individuals, corporations, special events. And then our partners at McDonald's. We have 100 McDonald's restaurants in our region. So that change that you put in, or when you round up on the app, that money actually comes to us. So about 26% of our budget is $3 million, comes from McDonald's customers. So when you're getting your Diet Coke in the afternoon, ask them to round up because we're getting that 62 cents and it adds up. Yes, thank you.
I have a statement, but first I want to jump on to Brian's thing. Also, Brian, not all of our nonprofits end in the same calendar or fiscal year, so that becomes very difficult. Like with Epic, ours is also June to July, but some are calendar. So, but yes, we do need to do more marketing within ourselves. The other quick comment I just wanted to make is this impacts everybody because you may get a lot of times people think nonprofit human sector is for people in need, and yes, they are in need, but anybody could need services. So you may be trying to hire someone for your companies who their families may need services, and you can promote all of our human services and this information as a benefit to attract someone to your company. So you can use it for different ways within your own companies as well.
So Eileen, Bob might have found Mr. Setti's presentation invigorating, but he did not have nearly as many guests as you have.
Hello, my name is Jared. This is more of a statement in support of Ronald McDonald House, something I've not really shared with the group before. My son, second kid, was born with spina bifida, neurological disorder of the spine. And long story short, we weren't able to receive care locally, so we had to go to Cincinnati in Ohio. And they have the nation's best Ronald McDonald, not to shame Peoria, and largest, but it's also a different style than all the other Ronald McDonalds. We have been there several times over the last 3 years. Probably we've stayed in a Ronald McDonald for 8 months of our life over the last 3 years. When I tell you we have saved thousands of dollars because of the generosity of the Ronald McDonald House and being one of those families where we're able to come in, see the volunteers, have a home-cooked meal, not have a financial expectation behind it. And regardless of the bad news that you receive, people are there to care for you still. It's different to be on that side of it. So we as non-for-profits, we can never forget what it's like to be on that other side. Because when you're finally on that other side, having that support makes the world of difference. So thank you.
Thank you for sharing.